A kiss so sweet it'll give you cavities. It may sound bizarre, but our next guest says it's true. Hello, Westchester. I'm Jennifer Jordan. I'm here with Dr. Ramin Tabib, who will tell us all about this phenomenon. Doctor, thank you so much for joining us today.
Thank you for having me.
Let's talk about, are we susceptible? I mean, saliva and cavities. Kissing someone can give you cavities. How?
Well, there are two bacteria that are mainly involved in cavities, called strep mutans and lactobacilli. They reside in your saliva and in the plaque. It's been shown that they can be transmitted through kissing, intimate kissing. So it's very important to know who you're kissing.
When you say intimate, you mean French kissing.
French
as
kissing,
teenagers may identify with a little bit more
saliva contact.
How do you know if you're susceptible?
You can be tested for it. There is a bacterial test called the CRT.
The CRT test, which we were going to get to if we can get a shot of this. How does this work?
It stands for Cavity Risk Test. It's a saliva test, takes 5 minutes to perform, and 48 hours to get the results back. Basically, it tests for three things. The level of bacteria, are you at a low level or a high level of these two particular bacteria? The flow of the saliva. Saliva is actually like a cleansing. It has antimicrobials, antibacterials. So you want to know if your saliva is produced well or you're very dry mouth, because that can proliferate the bacteria that's in there. And also the acidity of the saliva. If it's very acidic, it can ruin the enamel that protects the teeth from getting cavities. So these are very important things to know.
So by flossing twice a day, brushing our teeth every day, this is still not enough to prevent bacteria, this bad type of bacteria, from getting into our mouths?
Well, it's very important to do those things, but it's not the only way. Science has changed, and now we know a lot more about the disease process than we used to. So we can predict who is more susceptible to getting cavities. And obviously, if you have cavities, you want to take care of it, fillings and all that stuff. That's important. But the end point is not just getting fillings for the rest of your life. You don't want to be burdened by it. You want to have a good preventive program, and that's why there are certain prescription strength rinses and toothpastes available.
As we're seeing right now, that you can get these and use as a preventative measures.
Absolutely. They're prescription strength, so you have to have a prescription through your dentist. Depending on the level of activity of these bacteria, we tailor-make a regimen that can address the issues that are causing cavities.
Right. Even babies are susceptible. You look at your Aunt Flo, who comes in from out of town, and she's kissing on the baby. The baby can develop bad bacteria also? Yeah,
well, babies are more susceptible to getting the bacteria that are causing the cavities. So really we got to be careful with your kids. If you know that you're at a high level, you don't want to kiss them on the lips. Saliva contact is very important. Direct contact and indirect contact through shared objects such as cups, utensils, food, things like that. So you have to be careful.
But there's also good saliva.
Absolutely.
Talk about that.
The good saliva is actually kissing intimately promotes saliva flow. The more saliva that you produce, actually, what we were talking about, can promote a cleansing effect. It has antimicrobials, antibacterials in it that wash away these bacteria and kill them, and so saliva flow, obviously. On the flip side, it's a double-edged sword. Saliva can be good too.
So bottom line is, know who you're kissing, I guess.
Absolutely. Know what level of bacteria they have in their mouth and know who you're kissing. Yes.
Okay,
I agree with that.
Thank you so much for joining us today.
Thank you for having me.
And just ahead on the show,